everyone, my name is Alyssa and this is my patient Shelby. Today we're going to be conducting a posture assessment video. So Shelby, if I can go ahead and ask you to face the wall. We're going to be looking for a couple important landmarks here. Again, can I ask you to just go ahead and make sure you're standing up straight and tall like you normally would. Okay, so we're looking for her external acoustic meatus, which is the outer ear hole, to be in line with the shoulder here, the midline of the shoulder. And also we're just using C7 of the spine, making sure it kind of forms like a little triangle almost. So you can see she's got a little bit of a forward head, but nothing too severe. And the next thing we're going to go ahead and do is we're going to go ahead and assess her scapular level. So Shelby, if I could have you face this wall back here. So what I'm going to do is I'm looking for the inferior border of the spine. Again, stand up nice and tall, okay? Which is right here. And they seem to be fairly level. To go ahead and check this, I'm just going to find the spine of the scapula. And those seem to be level as well. Okay, the next thing I'm going to do, Shelby, if I can go ahead and ask you to face that way. I'm just going to go ahead and you can see from the side view here, I'm going to go ahead and check my patient for scoliosis. So a good way to do this is to just ask the patient to bend forward. So Shelby, if you could bend forward for me. And I'm just looking for a straight line in her spine. If there's any kind of curvature to the left or right, that's going to be a type of scoliosis. So she seems to be in line there. Shelby, if I can also have you stand back up now. Okay, another thing we can look for, assess for, is a lordosis. There is a slight lordosis in the lumbar spine, and then you'll have a kyphosis and then in the thoracic, and then another lordosis in the cervical. Now I'm going to go ahead and, Shelby, if I can ask you to kind of just bring your arm to the side. I'm going to go ahead and assess the PSIS and ASIS levels. So to do that, I'm going to use the iliac crest and come in on the PSIS, which those seem to be level in the back. And then using just the one side, I'm going to just mark my thumb here at the level. I'm going to come around and find the ASIS, which is here. So if I just kind of bring that around so you can get a better view, her PSIS is just a little bit higher than the ASIS. And what I'm finding from that is that she's got a slight anterior tilt pelvis. Okay, now Shelby, if I can ask you to lay down. Okay. Again, I'm going to go ahead and do the levels of her ASIS and just see, and those are similar in length. The next thing we're going to do is we're going to take a couple measurements. The first being the true leg length, which is from the ASIS to the medial malleolus. This will measure any function, any misfunction in bone structure. So you can measure in centimeters, and you're just going to compare the two sides bilaterally. So she's about 80 inches on the right side, and then if I do it on the left side, she's 80 inches as well. So that's even. And then another test we can do is apparent leg length, which is from the umbilicus to the medial malleolus, and that'll test for any other functional problems such as maybe muscles or the tilting pelvises as well. So again, you can measure in centimeters, and we're going from the umbilicus to the medial malleolus, which I have as being 88.5 centimeters on her right side. And then again, and on the left side I have 89, so she's a half a centimeter longer on her left side. So Shelby, if I can have you stand back up for me. Okay, and facing this wall here. Now I'm going to go ahead and take a measurement of the Q angle. So that's going to be measured from the center of the patella to the ASIS. And that measurement is going to account for any kind of patellar tracking problems that this patient may experience. Okay. So she's at about 10 degrees on her left side. And then we're going to do it again on her right side. Her right side, she's at about 8 degrees. Normal for women is about 15, but anything over 20 should be considered to be looked at by a doctor. The next thing that we're going to do is we're going to go ahead and look at, you can turn around for me. We're going to go ahead and look at her feet structure here. I've gone ahead and drawn with a marker her Achilles tendon and the way it goes. This is a valgus angle here in the back, and this will also account for, Shelby, if you can go ahead and face the other wall now. Face that wall, please. And then just lift up your leg. You can see that she's got a pretty big navicular drop, so that's, her feet are more pronated than supinated. Whereas if she's, go ahead and put your feet back down. Whereas when she's standing on both feet, they're a little more supinated. She's got a little bit of an arch, but once you go ahead and stand again on your other foot.
That one?
No. This one. Yeah. That navicular tends to drop to the floor, and that's called the navicular drop test. Okay, you can go ahead and stand back on 2 feet. Okay, go ahead and face the front. So, my patient Shelby doesn't have too much going on in her upper extremities. She's got a couple of things that could be checked into a little further with a more thorough evaluation in the lower extremities, such as her apparent leg length discrepancy, as well as her feet being valgus stressed and the navicular drop. Thank you.